There is very common problems in the female. Many females still they are not never pregnant, but suddenly milk secretion from the breast. Many patients has come with this problem. One female came to my clinic. She divorced 5 years back, and suddenly milk started coming from the nipple. If the female is getting the milk secretion without pregnancy, it is not good sign. It might create infertility, right? One female patient at the age of 45, now she was pregnant 15 years back. Now the younger son is 15 years. After that, never got pregnant. Now suddenly at the age of 45, we start getting milk secretion from the nipple. Why? What is the reason? Is my sound is low? Please, if possible, you can use a headphone because I have given maximum sound from here. I think, okay. So now in that way, okay. Shall I remove this? Now it is okay? Now it's better than the earlier. It's okay now. Okay, so let's go without microphone. So in this way, one female at the age of 22, she never, even she is not married, she never got pregnant, is still getting the milk secretion. Why? The reason is this: in our brain, try to understand the reason first. Because this is a very common problem, and definitely you might be facing this type of patient, and you will face this type of patient. Then we should know what treatment we can do, right? What is the treatment which we can do for the patient? In our brain, there is one structure that is called hypothalamus. Hypothalamus. Hypothalamus is the part of brain. Hypothalamus is very sensitive, and it is very deeply getting affected with the emotions like love, hatred, worry, sadness. These all things are affecting the hypothalamus. You see, have you seen like when someone is, when someone is in the love, okay, how we feel? Something strange, something different. That is because of the hypothalamus. That time, brain is not working. The person who love, that brain is not working the same way. In the hatred, in the lots of sadness, emotional suppression, when your hypothalamus is influenced, your intelligence is not working. Then hypothalamus is the direct controller of pituitary gland. Hypothalamus secreting some hormone, and with the help of hormone, it is controlling your pituitary gland. So the pituitary gland, suppose here, this is the pituitary gland. It is under control of hypothalamus. Then if your hypothalamus is good, then pituitary gland will be secreting wonderful hormone in the normal quantity, in the normal value. If the hypothalamus in the bad condition, in the emotional ups and down condition, then pituitary gland will get disturbed. There are three parts of the pituitary: anterior pituitary, posterior pituitary, and intermediate, means middle pituitary. There are three parts of the pituitary. Each and every part of the pituitary secreting hormones. Anterior pituitary secreting many hormone, and one of the hormone called PRL hormone or prolactin hormone. PRL or prolactin hormone that is secreted by the anterior pituitary. The meaning of prolactin, the hormone who is responsible for milk secretion, right? Milk secretion. So suppose one female is pregnant, and after completing the pregnancy, there are naturally the level of PRL are increasing. Then female are getting milk secretion from the breast. But in the other time, prolactin hormone is very low in the bloodstream. This PRL hormone even found in the male, but in the male it is in the very least level. It is also found in the female, but it should be low. Only it will increase after the female delivering the child. Then this PRL hormone will initiate the milk secretion. Now what's happening? Because of something. If PRL hormone is high, then what will happen? We know when the female is delivering the child, then PRL hormone is high and female is able to do the milk secretion. So until and unless PRL is high, female will be producing good amount of milk. And when the female is producing good amount of milk, so this is the natural message that female is feeding the child. Feeding the child. So during this time, the chances of pregnancy are very, very less or no pregnancy. Or we can tell the chances of pregnancy are very, very less till the PRL hormone is high, because this is the message the brain, the female is feeding the child. So the PRL hormone is creating temporary infertility. Temporary infertility. Because mother is feeding the child. But suppose the female is not pregnant, never pregnant. The female has not delivered the child, but due to some other reason, if PRL is high, then female start getting the milk secretion from the breast. And she might suffer with the infertility. So many females patient might come to you and they will be telling you that I'm having infertility. I'm trying for pregnancy since long time, maybe 2 years, 3 years, or 7 years, but still not able to get pregnant. When we are checking, then PRL is high, right? There are many other factors also responsible. One factor is PRL. And this PRL or the prolactin secreted by the anterior pituitary. In the Master Tung Acupuncture, we can balance it. Whether the belly of PRL is high or the low, we can work in both condition. We can initiate the natural condition. Suppose one female has delivered the child, still not getting milk. Why? Why the female are not getting milk many times even after delivering the child? Sometimes females are taking too much antibiotics for keeping the safe pregnancy. Might be they have many complications during the pregnancy, or female might suffer with some disease or getting the deficiency. Most of the female taking the too much antibiotic or medicine to save the complicated pregnancy are not getting the milk after delivering the child. Then also we can increase the level of PRL by the treatment which we are going to discuss. Even during the COVID, many female got COVID-19 during the pregnancy. They took medicines, and because of the too much hot medicine, they were never got milk secretion after delivering the child. So now we are going to discuss a wonderful protocol which will be balancing both the condition. Right. So let's see now. So first look at here. The normal value of prolactin are in the man is very, very less, 20 nanogram per ml in the blood. And even in the non-pregnant female, it's a very less, like 25 nanogram per ml. As soon as it is going more than 25, now the problem will start. Right? For the pregnant woman, it's more than 80. More than 80. But it should not be more than 25 if the female is not pregnant. I've seen the female is getting 35. They're having lots of problems, 45, 55. Without the pregnancy, if they're having the value of prolactin more than 25, it will create many other problems in the body with the infertility. So what is the treatment? The treatment will be 11 point, that is called galactorrhea. Galactorrhea. The milk secretion, milky nipple discharge, okay, which is not the normal in the normal condition. So that is called galactorrhea, and the point will be 11.24 or Fouquet, 11.06 or return to the nest, plus we are going to use 3-layer group that is called 77.05, 06 and 07. These 3-point combination, they are the wonderful point of Master Tung. They are called 3 layers group. The point 3, point number 1, point number 2, point number 3. Right? So the first point is called 77.05, second 77.06, third point is called 77.07. We can see the distance from the ankle joint. The first point will be 3 chun, the second point will be 2 chun, the third point will be 2 chun. Right? As per the TCM, the point is gallbladder 39, which is 3 chun up from the ankle joint. So these 3 points are not only good for this condition, these 3 points are good for any problem happening with the female breast. So these 3 points has been considered a wonderful combination for all the problem happening with the female breast. 77.05, 06, and 07. Right. I will show you the points location. Let's see how to put the point. Look at here. I will show you one video. So look at here. So we can see from the ankle joint, first we are going 3 tune up, then 2 tune up, then 2 tune up. So these are the 3 points. And we are needling with the even method without any concept of the tonification sedation, just needle in any direction. So this is the first point, 77.05. And this is the second point, 77.06. And the third point, 77.07. Whenever females suffer with any type of the breast disorder, like the breast distension, heaviness in the breast, cyst in the breast, fibroma in the breast, we always use these 3-point combination. It is a wonderful combination for all the problem happening with the female breast. Right. So when we put these 3 points, what we are doing, how we are searching, I will show you here in my leg. So look at here. Audio is not clear. Audio is not clear. Now it's clear. Now audio is clear. Okay. Done. Okay. So look at my leg. You can see my leg, right? I will show the points. So this is the ankle joint. We can see this is the ankle joint, right? And we can see this is the medial malleolus and this is the lateral malleolus. And we can feel the bone. One bone is here, that is called tibia bone. And one bone is here, that is called fibula bone. Fibula bone, right? So now from the ankle joint, now I am searching the both bone. Okay, this is the tibia and this is the fibula. 2 bones. Now try to search the depression in between, gap in between these 2 bones. This is the front bone, this is the back bone, and we are trying to search the depression in between. The main, we have to search this depression. Are you able to find this depression between 2 bones? So now what we have to do, we are in the depression, we are searching, and we can feel the one bone this side, another bone this side. So we are in the depression and on the border of this fibula bone. So I am moving in this depression, but on the border of this fibula bone. So this is the area we can correlate with the gallbladder meridian, because gallbladder meridian passing from this depression, then the gallbladder meridian going here, then the gallbladder meridian is reaching here, right? Ending here. So this is the lateral side. Even we can do in that way, we can feel this is the depression here. Okay. And this is the root of the gallbladder meridian. Now from the ankle joint, if I keep my forefinger, so this is the point number 1 that we can correlate with the gallbladder 39. We can correlate with the gallbladder 39. Okay. So let's see. So from here, if I keep my forefinger, I can feel the depression here, and I will put the point number 1 here. You can see this is the 77.05, the point 3 chunak. Wonderful point for all the disorders connected with the female breast. Even the single point is enough. Even the single point will be working for the female breast. But when we are combining 2 more points, the effectiveness increasing multiple times. So I am going to tune up, adding 1 more point in the same gap. Then again, I am going to tune up and adding 1 more point here. You can see. So these are the 3-point combination. I think it's clear. At the 3-point combination, is it clear? 77.05, 77.06, and the 77.07 between the 2 bones, between the gap of the 2 bones, but on the border of this fibula bone. Depth, we can insert the needle half tune to 1 tune. Even the half tune insertion is good. Okay, now. So after now, now I'm removing the points. So I will show you. Fine. So these are the points called 3 weights. Very famous point of the Master Tung. With the help of these 3 points, on the gallbladder route. Now you can see once again this video. Now you're able to find out. Look at here. So from the lateral side, if we are going 3 tune up, then 2 tune up, then 2 tune up, we are drawing 3 points. These 3 points are called 3 weights. Wonderful point combination, 3 weights. These 3 points are a very good point for the female breast, and not only breast. These 3 points are one of the great points for each and every problem which is connected with the throat region. Throat. What is the problem with the throat? Whether the thyroid problem, hyperthyroidism, hypothyroidism, throat infections, throat pain, whatever the problem which is having connection with the throat, we always use these 3-point combination. 77.05, 06, and 07. The question comes, why these points are good for throat? So the answer is this. We know when someone is getting throat infection, what we are telling, oh, attack of virus in flu. What's happening in the flu? We are getting throat infection or not? Initially, when there is attack of flu, we are getting little feverish, and after that we are suffering with the throat pain, throat infection, tonsillitis, pharyngitis, laryngitis, and redness inside the throat. As per the acupuncture, we are telling attack of wind, attack of virus, attack of flu. These 3 points are in the gallbladder meridian, and they are expelling wind. Wind. What is wind? Wind means virus. Wind means bacteria. Wind means pathogen. Wind means cold air. Wind means hot air. Throat infection is wind heat. If the virus is attacking, we are not telling virus, we are telling wind attack. In the acupuncture, virus means wind. So if someone is having throat infection, oh, maybe some flu attack, what to do? Expel the wind. How to expel the wind? With the help of 3 weights, 77.05, 06, and the 07. Right? So what we are doing? So first I told these points are good for breast. Right? Breast. One female is telling, okay, there is a milk secretion from my breast. Okay. So we can use 77.0567 one day on the right side, second day on the left side. In the first sitting, we can use one side. In the another sitting, we can use other side. We never use bilateral, never, right? One female is telling, I am having some unwanted growth in my breast. There is a tumor, there is a cyst in the breast. Okay, which breast? Right breast. Okay, right breast, use the point of the left side, opposite side. Because cyst in the right breast. Oh, no, left breast. Okay, no problem. If you are having cyst in the left breast, use the point in the right side. Both breast, no problem. One day right side, one day left side. In that way, we can do the plannings. But never forget our 11.24 and 11.06. They are the first point which we have to put. I will tell you, one female patient told, doctor, I'm having breast lump. Okay, she told me on the right side. I put the point 11.24 opposite side. In the 20-minute, lump becomes soft. In the 20-minute, right? Even I get surprised because it was not written in the book or anywhere that in the 20-minute you will see the changes, but female is telling, doctor, my lump becomes soft. Then we are collecting the experiences. Yeah, it's really working, right? Wonderful point. So suppose one female is telling you, can you treat my cyst in the right breast? Yes, it's right breast. Okay, 11.24 in the left side, 11.24. So we will take the 2 needle and we'll start doing the treatment on the left side first. 11.24 in the left side. So point number 1, we know in the F line, right? Point number 1 and point number 2. 2 point, right? 11.24. Okay, problem in the right breast. Then 11.06 on the same side means where they are the pair points. 11.06 will be here. 11.06, right? Because we are treating the right breast problem. Now 77.050607 will be in the opposite side. On this side, is this side, right? 77.050607 here. Wonderful point combination, right? Okay. Even for the PRL, prolactin hormone, this is the protocol for the PRL. You want to treat only 3 points, enough. 11.0, 11.24, 11.06, and 3 weight point. And you will be surprised, even this much protocol is enough. Patient will tell you some changes happening in even after the first sitting, because when the patient will be coming to you, patient will not only complain about the milk secretion, even there are lots of heaviness in the body, headache, migraine. Generally, the females having more PRL hormone, she also will be having migraine headache. PRL hormone is secreted by the pituitary gland, and it's create unwanted heaviness in this area. Sometimes it creates too heaviness. Even some patient might suffer with the tumor in the pituitary gland. Tumor. But migraine is very common. Migraine, body pain, moving body pain. This is the common feature. As soon as we put these points, even we will see improvement in the symptoms. No need to put the separate point for each individual problems. Enough. This much is enough. So now one person is telling, can you treat my throat infection? Only 3 point to expel the wind. Even we can use some other combinations, which we are going to discuss shortly. So look at here now. I will show you the full treatment protocol here. So look at here. galactorrhea, milk secretion, 11.24, 11.06, and 3-layer point, right? 3-layer point. So these are the combinations. Yesterday, we already discussed the treatment protocol for the leukorrhea, 11.2 for 11.06, and the point lingudavae, right? Lingudavae. And we also have discussed for the delay menstruation, 11.2 for 11.06, and 1 point on the head and 1 point REN 24, right? We already discussed this thing yesterday. Prostatitis we have discussed yesterday. 11.06 will remove the cold condition and will improve the prostate infections, inflammation. I would like to bring a focus here. Many females are delivering the child, and after delivery, maybe because of the multiple delivery, and maybe because of due to some reason, the uterus become very, very weak, very weak. So weak uterus, or we are telling it cold uterus, weak uterus, it is becoming weak. The causes multiple pregnancies, or maybe some female is not able to take care very properly during the pregnancy, and maybe because of the multiple abortions. Even sometime for some female, the single abortion also creating the problem. It depends on the constitution, internal power. So 11.06 is the very good point for the female if they are having big uterus due to abortions or due to multiple pregnancies, right? 11.06 is a very good point. So if the female is having pain in the pelvic area, if you put the spleen 6, definitely it is also going to work, because spleen 6 is the distal point. But spleen 6 will be working only for a short duration and the pain will start. But the 11.06 will be working for the longer duration, and the problem will not be coming back till the longer duration. So 11.06 is one of the great points for male and female both, and it's giving a wonderful warmness to the male genital part as well as the female genital part. It's promoting the yang qi in the male and female both, right? So even one can massage 11.06 point every day to keep the uterus healthy. This is the point here. One can massage here, or you can rotate the sujog ring, or you can do the pressure with some pen, refill and all, or any object. It is good for male. Many males are having history of, some of our students also told me, doctor, my father is having prostate, even I am getting some primary symptom of the prostate enlargement. You will never get the prostate enlargement if you just stimulate 11.06 point, because prostate enlargement is very common, and it's happening because of the collection of humidity due to coldness. Okay, so 11.06 will improve the yang qi. It will not allow any gathering of the humidity, then there is no any enlargement, right? I would like to show you one more point here. One very wonderful point for male suffering with the erectile dysfunction or impotency, especially diabetic person. They are getting too much weakness and suffering with the impotency and the erectile dysfunction. And when you use this point, never think just you're working on the erectile dysfunction, you're also working in the chi deficiency. So I would like to bring a focus on very wonderful point. That is a very good point for male and female both. Look at here. Yesterday we discussed. That is 11, that is 88 point. This is the very good point. So we can see here, this is the point, 3-point unit. Starting from the medial corner of the patella, 1 point just on the medial border of the patella, right? This is just on the medial border of the patella, 1 point to tune up, and third point is to tune up. We can put all the 3 points in the line. They're the wonderful point working on the male erectile dysfunction and improving the kidney essence. And one of the great points for diabetic person, because diabetic person is suffering with the secretion. They are having very poor sexual energy. And poor sexual energy also creating too much weakness in the body. So these 3-point combination, yesterday I told you already, but today I would like to bring your more focus on these points, 88.09, 10, and 11, right? These are called 88.09, 10, and 11, or we are telling them penetrating point, 3 penetrating point. Remember this point. On the medial border of thigh, on the starting from the medial border of patella, right? The first point is just on the medial border of the patella, second point to tune up, third point again to tune up, the 3-point combination. The middle point is spleen 10. So from the spleen 10, you can draw 1 point to tune down, 1 point to tune up, and you can put the 3 needle here. Wonderful point combination. Nowadays, it's very common problem. The diabetes is one of the great problem, and with the diabetic persons, it is also the very great problem to suffer with the erectile dysfunction, right? Yesterday already demonstrated how to needle these points, right? Remember, yesterday I demonstrated how to needle. Yes or no? Yes. Yesterday demonstration was there, how to put the point. You can put all the 3 points in the same way, right? Any male having it moving toward the diabetes, use this point. Because and with the purpose to improve the erectile dysfunction, not only erectile dysfunction. In the Ayurveda, we are telling Ojachaya, Sukrachaya. Diabetic person suffering with the Ojachaya. Sukrachaya means very poor sexual energy, sexual essence, kidney essence. We can improve the kidney essence. So we will put this point to the diabetic person, and for the normal person having very, very weak constitution, we will improve the energy of the kidney. And many young male, when they are doing too much physical mental work in the colleges, living in the hostel life, not eating the right food, they also become very shrinked and wrinkled skin, shrinked, poor mindset. That time also we can improve the enthusiasm. Why these 3 points? I will tell you, even if it is not possible to needle, tell them do the gua sha. Do the gua sha on the medial border. Just do the rubbing on this point while applying the oil, or just take the comb and do the gua sha here. It will give a wonderful effect. They are called penetrating kidney point, penetrating kidney. And this is entering in the genital part, so giving the wonderful effect, right? Now, so look at here. Suppose this is the comb, right? Comb. Because someone, maybe your family member, okay, living somewhere in the hostel, not eating the right nutritious food, so slowly and slowly suffering with the body weakness, bone weakness, then you can suggest them take any comb and just do the rubbing here on the medial border. 1 minute is enough. So can do the rubbing here on this point, then two chin up here, then two chin up here. 1 minute. It will improve the enthusiasm. And when the person is doing rubbing, even can be done in both the leg. But when you are putting needle, never put needle bilateral. Now for female, we can use this point. For female, we are using this point because kidney essence is helpful for male, female both. Female might also suffer with the diabetes, right? Diabetes is not only happening with the male. We can use this point, right? For male, female both. Now, let's move ahead, and I would like to go and would like to discuss one very common condition nowadays that is called uterine tumor or uterine cancer, right? Uterine tumor and uterine cancer. Many female suffering getting the uterine fibroid. Then doctor telling, and even they are getting the continuous growth of the uterine fibroid. Then some of the female also suffering with the uterine tumor. Sometimes it's normal benign, but sometimes it might be cancerous. Right now, I am just talking about the uterine tumor. Whether it's cancerous or it's not cancerous, I am going to discuss both conditions. Before proceeding to this discussion, I would like to tell you, whenever any cancer is spreading in the human body, the spreading, when we talk about the metastatic cancer, the meaning of metastatic cancer, it can spread anywhere in the body, right? It is spreading via the bind energy, right? Bind. So whenever you plan any treatment of the cancer patient, first you have to control the bind energy. You have to calm down the bind energy. Without bind energy, you cannot stop the cancer. Got it? How to control this? So first I would like to show you this protocol. Look at here. So we are using Fouquet on one side. Fouquet means 11.24. Right? This is the point number one. Fouquet. And we are going to arrest bind with the help of liver 2, liver 3, and the liver 6. For arresting bind. So how can we arrest the bind by the liver 2, liver 3, and liver 6? This is the question. In the 5-element cycle, we know liver is the bind that we know. And we have liver 1, liver 2, liver 3, liver 4, and the liver 8. Liver 1 is the board, liver 2 is the fire, liver 3 is the earth, liver 4 is the metal, and liver 8 is the water. Liver 1 is the wood, the same element, because liver is also bind or wood. So liver 2 will be fire. Liver 2 is the fire, right? and liver 3 is the earth. So here liver 2 will be the sun point, and liver 3 will be the grand sun point. In the TCM, there is a concept: if we sedate the sun point and we sedate the grand sun point, we can reduce the energy. So sedation of the liver 2 and sedation of the liver 3, the 2-point combination will be very wonderful and will able to arrest the liver bind. In the Master Tung, even the even method is enough. No need to sedate. Just putting the point with the even method will be enough. So we are starting the treatment. We are putting the Fouquet on one side. On the next sitting, we can change the side. And liver 2 and liver 3, we are putting the points here, right? Then after that, I would like to bring a focus here on the liver 6. Liver 6 is the wonderful point. Liver 6 is one of the great point in the TCM. So I will show you the location here of the liver 6. Look at here now. If you see the location, liver 6 is point 7 chin up from the ankle joint. Remember the location, because I am going to tell you a wonderful thing about the liver 6. Because it's a very famous point used by the Master Tung as well as the TCM. When we are doing cupping on the liver 6, this cupping is very wonderful, treating all the problem of the genitals. Like some male is having enlargement of the testes or pain in the prostate, or there is a problem of hydrocele. It's a very complicated and challenging problem. We do the cupping on the liver 6. So from the ankle joint, we are coming 7 chin. This is the location of liver 6 here, just on the border of bone. If from the ankle joint I'm coming 5 chin, 3 chin, then the 2 chin. Then the liver 5 chin, and the 7 chin, that is liver 6. Generally, we do the bloodletting anywhere from here. Or even we can do the massage here between the liver 5 and the liver 6. It is one of the great area for male and female genital part. Whether the male is suffering with the prostate enlargement, we can use this. And for the female, we can use for the uterine cancer. So 3 point. Liver 2, liver 3, and the liver 6. We have arrested each and every unwanted growth in the uterus. So we will start the point. First, we are putting the point Fouquet or 11.24, 2 needles. Then we are going to put 3 point here. 1 needle will be on the liver 2. 1 needle will be on the liver 3. 1 needle will be on the liver 6, what is 7 chin up. So if I'm using the Fouquet in the right hand, my these 3 points will be opposite side. So making the circuit, right? So this is the circuit we have made. Number 1 point, 11.24, and 3 point in the leg. So with the help of these 3 points, what we are doing, With the 11.24, we are stimulating the uterine energy. And with the help of these 3.11, liver 2, liver 3, and the liver 6, we are controlling the unwanted growth of the tumor. Okay, now step number next. Step number next, we will be using 3 point that is called lower 3 emperor. So I will be showing the video of that. Only there are 4 steps to treat this condition. Now I am showing 3 point in the spleen meridian, and they are called lower 3 emperor spleen meridian, right? One will be spleen 6, one will be near spleen 9, and one will be in between. So let's see now. So we can see this is the medial part of the lower leg, and this is the spleen meridian. So we are moving to this is the first point, that is spleen 9. Okay. Sometimes we are putting the spleen 9, and even if we are putting the point just next to the spleen 9, that is also we are considering as a upper emperor, right? So this is called upper emperor. We can put any one point out of 2. Spleen 9 or the point 1.5 chun from the spleen 9. So lower 3 emperor means upper emperor, middle emperor, who is in the center of the lower leg. Okay. And so upper emperor, middle emperor, and the lower emperor. Okay, 3 emperors. So one point will be spleen 9, or another the point 1.5 below the spleen 9. There's the middle emperor, and the third, that is spleen 6 or the lower emperor. Spleen 6 or the lower emperor. So in a very simple way, spleen 6, spleen 9, and 1 point in the center. The 3 point combination is called 3 emperor or lower 3 emperor. Right? Wonderful point combination. We always put these 3 points. Here we are showing some other point, but right now just focus on the spleen 6 here. Right? So the lower 3 emperor is a very good point combination working on the female uterine problem and male and female genital problems. Let's see how to put the needle here. We can choose any one point from the upper 2 point, right? So let's see now. So first we are putting the needle on the spleen 9. Then we are putting the point, this is the point just in the middle part of the lower leg on the spleen meridian. And third, we are putting the point at the location of spleen 6. And the most beautiful thing is this. This is a very good point. In the Master Tung Acupuncture, we are using these 3 point combination very, very frequently. Very frequently. Right? So we started our journey with the 11.24. Then we arrested the growth of tumor by bind point liver 2, liver 3, liver 6. Then we have taken the 3 point that is called lower 3 emperor. This point combination is working for each and every problem of the uterus. The last point will be the point found in the stomach meridian, because stomach meridian is the meridian who is passing through the uterus and supplying the uterus. Stomach 36, 37, and 43, 3 point. So if you look at in this image, this is the stomach meridian. It is passing from the uterus, right? Then from the knee, if you go 3 chun down, stomach 36. Again 3 chun down, stomach 37. Right? Stomach 36 and 37. And the last point will be stomach 43 in the feet. Right? Why we are choosing the stomach meridian? Because stomach meridian is crossing the uterus. In the future, you will see for any problem of this area, we will use these 3 points again and again. So now this is the final protocol for any unwanted growth of the uterus, not only uterine cancer, but also we can treat the uterine fibroid with the help of this protocol. So Fouquet will be one side or 11.24. Then liver 2, 3, and 6 will be other side. And here, Jinsen Huang means lower 3 emperor, just I discussed with you. And these 3-point combination. So this is called global circuit of Master Tung for uterine cancer, for uterine tumor, for uterine fibroid, for endometriosis, unwanted growth in the wall of uterus. We can use for even the ovarian tumor, ovarian growth. The same protocol can be used for ovarian cyst. And even for the male uterine problem, right? Done, understood, clear? You can try this protocol. It's a wonderful combination. It's a wonderful combination. Done, understood, clear? Okay. So look at these 3 points in the image. I will show you here. So look at here. In this image, it's written 77.07 means spleen 9. 77.21 means spleen 6. And 1 point just in between. Instead of here, you can also put here or also put here as per the Master Tung. If you miss the point, no problem. But do not miss the line. Be in the same line. This technique is called Dao Ma technique. Dao Ma technique. The meaning of Dao Ma technique, we are putting 1 point, it is going to bring very wonderful effect. But in the same line, you are putting another point, effectiveness will be increasing multiple times. And we are putting 3rd point, now the effectiveness will be too much higher. So that is called Dao Ma. Dao Ma means on the single line, we are putting 2 points or 3 points to increase the effectiveness. In the Master Tung, the Dao Ma is very common, very, very common. Whenever we are going to put the point, and immediately we will put another point for the support and will create the Dao Ma, right? Okay, let's proceed ahead. So it's a very easy to find out whether to put the right side or the left side. When patient is telling you, can you treat uterine fibroid? Yes, yes. Now the question comes how to decide we have to put the right side or the left side. Because uterine fibroid is not visible. from the naked eye, or even from the report, uterus in the central. Then what we ask, okay, do you have some other problem? Then patient will tell, yes, I have knee pain. Okay, tell me which side? Right side. Because the female is suffering with the uterine fibroid and also having some other problem on the right side. Okay. So the energy, the disturbed energy is more dominant in the right side, then we'll put the point in the left side. In that way, we are deciding. Right. One female told that, can you treat my ovarian cyst? Now again, I asked, okay, can you tell me, do you have cyst in the right ovary or the left ovary? She told that I don't know. Okay, no problem. Okay. Any other problem you have? Yes, yes. I have back pain on the right side. Done. Put the point, start from the Fouquet. Now we will be putting the Fouquet point on the left side. And the female will tell, oh, I'm feeling much better in the lower back, because if you see in the reality, even the uterine fibroid, even the deeper level problem will be creating some effect here and there. Never think that shoulder pain will be just because of shoulder. It might be because of the uterus or the prostate. The lower back pain or the knee pain might be because of some internal disharmony. So ask, okay, I have left shoulder pain, but I don't want to treat my shoulder. My treatment is going on. You treat my heart. My heart is weak. Okay, you are having left shoulder pain. Then I will be putting the point in the right side. And when there is a question of liver point, we always put in the left side, because liver energy is more dominant in the left. Okay, definitely we have put in the right hand, left hand, right leg, left leg, but we put the point in the left side. But we can also keep on changing. One day right side, one day left side, one day right side, one day left side. Then we will able to control entire energies. Done. Over. Any question? Uterine prolapse is very, we can treat the uterine prolapse very nicely. For even the uterine prolapse, we have to use the same protocol, but for the uterine prolapse, why the uterine prolapse is there? Because your body is not having enough energy to hold the uterus. Then I told you, maybe many female are getting uterine prolapse because of the multiple abortions, multiple deliveries. Then 11.06 is the point. 11.06 is the point of triple warmer, who is giving too good heat and bringing back the power. So if they want to work on the weakness of the genital part, on the looseness of the genital part, you can work with the 11.06 and it will again start good holding. So make the complete protocol 11.24 and the 11.06, 2 points will be enough. And we can also combine little knowledge of the TCM. As per the TCM, do the moxa to raise the yang. If you want to work on the uterine prolapse, you need to raise the yang. The meaning of yang, energy one is moving upward. And when yang is weak, the thing is going downward. Uterus is going down. Again, raise the yang. How to raise the yang? There are too many points, like DU20 moxivation, DU20 moxivation. Even we have many other points also. But right now, I would like to tell you what treatment protocol I discussed today for the uterus. Right? I will show you once again. The same protocol will be useful even for the uterine prolapse, because 11.06 point, one of the great point, 11.06. Look at here. 11.06 will be supplying good yang energy. So the same protocol will be useful. We have to add 11.06. It is a wonderful point. 11.06 point also very good for the male, for erectile dysfunction, for improving the yang energy, for removing the prostate problem. This is the same protocol you need to use. I have shared this story many times, but I would like to repeat it again. Patient came to me and told, doctor, I took the treatment for hydrocele. If you are aware what is hydrocele, hydrocele means enlargement of the testes. There is no any treatment, just surgery is advisable. But he was very lucky patient. He went to one village and took the treatment by some doctor of the village, and he did the Agni Karma or the cauterization on the liver 6. Agni Karma or cauterization on the liver 6. After doing the Agni Karma or the cauterization on the liver 6, he got some boil with the pus formation and he suffered for 20 days. But within a month, hydrocele disappeared. This is the beauty of liver 6 point. So liver 6 point is having very deeper connectivity with the genital part. Okay. So thank you so much. Now see you tomorrow. Okay. For breast lump, stomach point will change. Bin liver lower. See. Yeah. So stomach, you see, stomach is very deeply connected with the breast, right? Stomach is very deeply connected with the breast. So if we will keep on changing. One day we will be using the stomach point in the right side and other point in the left side. In the second sitting, we will change the side, right? So now we will meet tomorrow. Tomorrow is okay. Fine. Okay, we'll announce because we did the class. Today is the third day of the free class. Now we will see. Now our paid class will start. So now whoever has enrolled, we will be giving the information in the paid group, right? This video will be put in the normal group so anyone can see again. For the hypothyroid we discussed today, 77.05, 06, 07 is a very good point, but we will be discussing more. Okay, fine. Now remaining question you can ask in the group. Okay, fine. Yeah, thank you so much. Closing the session now. For back pain, you can use the point I already discussed yesterday. Sir, group is full. No, group is not full. You send me personal WhatsApp. I will add you in the other group, right? Okay. If group is full, you can call me. Yes, you can call me. If even you have any question, you can post in the group. So for the prostate, we are going to use 11.06. It's a wonderful point, but we will be adding a few more points like penetrating kidney point, right? Lower 3 emperor. Right now, I discussed with only one point, but because there's a class of protocol management, so we have to discuss a very specific protocol so that practitioner can apply this protocol directly to the patient, right? So from